So let's talk about medications and how medications is needed. Now, this is something, how many have you have done diet and they have gained weight after that? Any diet? Tell me.
I have done it many times.
How?
Yeah.
Give me an example of a diet. How many? Give me an example. What diet did you do? For how many days?
I did like when I started, I did first my own diet, like taking more protein, low carbs, some exercise. I did it that was the first time when I started, and I was very young at that time. So obviously the metabolism was also quite fast at that point in time. And I lost a lot of weight, maybe 50, 60 pounds. And I kept it off for like 4, 5, 6 years before I got married.
Yeah.
But yeah, and but I was not eating. I was eating extremely less, very calculated, mainly on fruits. And after a year, that was become my, it became my routine. I could not eat much, less cravings, less of everything. But then everything started back with my first pregnancy.
So
that when I
changes,
got the liberty, to eat, and you got married, you are having the
life
baby,
changes,
so you feel that now you have the liberty, because I like to eat, and I started eating. So again, it came back slowly, but it came back.
So think of
by
it. It was a disease. You were able to hold it off with your lifestyle, and as soon as, of course, there's some disease progression, but as soon as you withdraw that, whatever the treatment you were doing,
it came back, everything. And then I did not lose it right away after the delivery. And then with the second pregnancy, more weight came on top, and I went back, or maybe you can say a little more than what I was actually.
Yeah.
And I then twice I joined Dr. Bernstein diet also. That also helped me. It took me about 6 months, and I lost around 20 to 30 pounds. But of course, Dr. Bernstein diet is very expensive, and you cannot stay on those that diet and needles for the rest of your life. So when you leave it, it takes time, about 8 to 10 months. But the moment you go back to your normal way of eating, or like in my case, I like to eat, so maybe you can say I have more portions and I eat more, and I eat maybe wrong food, but eventually everything came back.
So here's the thing. So I'm glad that you brought this point, because this is the key turn here. So this is what happened. So a person who is 250, right? And he wants to lose weight. So when he starts lose weight, 10, maybe 15 pounds, whatever his range is, after that, the body will stop, because you are going against body's wishes. So what happens at that time? So
no, this is even though, sorry to cut you, even though you are following the diet, a plateau stage comes where your weight slows down and stops.
Why? Because body is holding you. Body does.
So they suggest that you should have a few cheat days, eat normal, eat a lot of carbs, to cheat your system, and then it will lose. But I don't know, it never worked. Once I start eating, then it's hard to stop. So it didn't work in my case.
Okay, so we already answered that when you're slowed down and your numbers are not changing, because your body is holding you. Body is holding you, because you are going away from whatever the set point your range is. So here, what I want you to understand, most of you would say, so a point will come in your life or in your dieting, maybe 2 weeks, 3 weeks, 4 weeks, or maybe 6 months, that what will start to happen is that you will start to feel more hungry, because what body is doing is body wants you to come back to its weight. So body will start kicking more bad hormones, which are your hunger hormone, less of a good hormone, which gives you a satiety feeling, a feeling satisfaction. At the same time, the body wants you to slow down. You feel tired. You don't want to exercise. You want to lay down. And then you have these high craving that you just don't want to have a salad bowl that you used to enjoy 2 months ago. And you want to, you get really provoked by stimulus. And all of this causes increase in appetite, decrease in energy. And then one day your husband or your children, you come and they hug you and say, Mom, I love you what you are. We don't like you the way you are, lying down. Please forget all this dieting. And then what you do, you come back, you start eating, and then you kind of are hard on yourself that, oh, I'm never consistent, I'm always like that, I start a diet and I never complete it, and you kind of blaming yourself and start eating yourself. So you gain back, you gain back whatever you baseline, but the body does not stop here. Body will regain. And why? Because body took that weight loss as an insult. What happens to us if we lose $100? If we get an opportunity to earn it back, would we just stop at $100? I will say, no, I want to earn 500. I don't want to get into that situation again. Body does the same thing. So that is what happens with yo-yo dieting. Because here we have no control. So what we learn from here, that upon when you lose weight of whatever the range is, if you want to lose more than the range, the body will stop. And the things will not in your hand. So the medication will help you on that part, will cause decrease in appetite, make your metabolism on the right track, increase your metabolism. And then at the same time, you're working on the behavior. And the behavior is that it is a chronic disease. So we're not going to go anything unrealistic. So 3 pillars I always tell my patients. We have to do something sustainable, realistic, and enjoyable. You cannot, if we say I'm going to stick on keto diet for the rest of your life, we cannot. We still have to eat on the weekends. The other thing is that there's no concept of cheat day. We don't cheat. Being a responsible person and human, why do we use the word cheat? Cheat puts it at the back. We want to enjoy everything. There's nothing prohibited, nothing haram, no punishment. Have a good relationship with food, but eat in portions. So this is what I tell my patients, and this is what I advocate, that in my practice, you enjoy your life, but you eat in moderation.